Okay, I want to welcome everyone back. I hope you all had a good break or hung out in the chat room. Thank you for joining us. This is a discussion group. We are going to hear from two presenters and then we'll open it up so that we can discuss a little more casually. And we're going to talk about advocacy this evening. The first person to speak is Katie MacDonald. Welcome, Katie. Katie is the Director of Federal Policy for the Alliance for Headache Disorders Advocacy, and she is also the Director of Operations for Miles for Migraine. She also lives with migraine disease, and she has been kind of leading the AHDA for a number of years. She is really inspirational and knows a lot about advocacy on the policy level. So welcome, Katie.
Thank you so much, Eileen. All right, well, hello, everyone. I can see some of you on the screen. Thanks so much for taking the time to join me tonight. As Eileen said, I'm going to take you through a couple of slides, a little bit of a presentation about advocacy. My goal is to talk to you about advocacy, to help you become more familiar with what this annual advocacy event called Headache on the Hill is and the organization behind it, AHDA, and talk to you about how you can get more engaged in headache disorders advocacy, and also fill you in on some of the recent initiatives that we've been working on, just to give you an idea more about some of the types of advocacy we're involved in. So I feel like whenever you talk about advocacy, everyone has a different definition of what advocacy is. And I think sometimes people get intimidated because they hear the word advocacy and they think, you know, that sounds pretty scary and high level, and I'm not sure I want to get involved in that. And, you know, when you Google advocacy, it says it's public support or recommendation of a particular cause or policy. Well, what does that mean? When I think of advocacy in my head, I think advocacy is about education. It's about raising awareness. It's about being passionate about something. And really persistence is a big thing with advocacy. And it can come in so many different forms. Advocacy can mean something like coming to this event called Headache on the Hill or participating in Headache on the Hill. But it also can be as simple as, you know, maybe you're wearing a shirt that says, you know, your cluster 5K event shirt, or, you know, some type of shirt that prompts people to ask you a question about what is that, and you get a chance to tell them a story. Advocacy can be, you know, having a conversation with somebody and having them make a comment about your disease state, and you kind of knowing when the right time is to engage and correct their misassumptions about that disease, or to provide education to them and becoming a resource for others. It can be writing a blog, it can be speaking about something, it can be talking to your members of Congress. So it kind of runs the gamut. There's no one definition of advocacy. I think Albert Einstein has it down. It's not that I'm so smart, it's just that I stay with the problems longer. Advocacy is about kind of having that persistence to stick with an issue and work to drive change. Change public perception, change policy, change people's impressions. So the organization that I work with that is most engaged in advocacy is the Alliance for Headache Disorders Advocacy. And some of you have probably heard about, or even I recognize some of you have participated in Headache on the Hill. And it's an annual event that takes place usually in Washington, D.C., prior to our life with COVID. It's a once a year event where we bring together clinicians, researchers, patients, caregivers, all types of advocates come together and educate Congress about the need for equitable resources for people living with headache disorders. The way the event usually works is that we come together, we have a day of advocacy training, we teach you about how to tell your story, we teach you about whatever the specific ask is for that year, and then we break you up into teams, and the next day you go to Congress, you go to your members of Congress, your senators, your representative, and you take them a specific ask. And, you know, a lot of times I get the question from people about, I'm not sure Headache on the Hill is really for me. I'm not political. You don't need to be political to get involved in federal policy advocacy. It's really primarily about telling your story, about your experience living with this disease, how it's impacted you, your family, your friends, your coworkers. And those personal stories are what these members of Congress or their staffers really remember. And then after you share your personal story, you slip in a request for, $50 million in funding for research. It sounds kind of funny, but that's essentially what's happening. You're connecting with people on a personal level, and then you're making a specific request. And just to give you a little bit of background, the whole reason that Headache on the Hill started was back in 2007. It was started by two providers, Dr. Shapiro and Dr. Gardner. They just recognized that there was a severe discrepancy in the amount of resources that were being allocated to migraine, cluster headache, and other headache disorders. And their first issue was to take on the National Institutes of Health. So for those of you in the US, this is where most of the funding comes from for research. And this is how new drugs get developed, discovered through research grants from the NIH. And this chart, which actually comes from the NIH website, has all these little blue dots, and it shows, as you move from left to right, the further out you get, the more burdensome a disease is. And as you move from top to bottom, you have the least funded to the most funding. So you can see generally there's kind of a regression line where everything kind of falls, as the disease gets more burdensome, the funding goes up. But you see, if you look at, right straight down the line here, headache and migraine are among the least funded diseases of those that have the same level of burden. So they're considered to be similarly, the impact is similar to breast cancer and arthritis and digestive issues. But those diseases are funded at 10, 20 times more than what cluster headache and migraine currently gets. So it's kind of been at the root of Headache on the Hill and AHDA advocacy to try to increase the amount of funding. And interestingly enough, one of the first issues that was accomplished through AHDA was even getting a dot on the map for migraine and headache disorders, because they didn't even used to report how much funding there was for these disease categories. So we didn't even know. But initially, back in like 2008, they got the NIH to at least start reporting so we could measure our progress over time. So looking at Headache on the Hill over time, it's an event that's grown quite a bit. When it first started in 2007, there were 45 people that went to DC, and only 4% of them were patients or caregivers. It was essentially all providers. They represented 29 states and visited about 25% of the congressional offices. Last year, with COVID, we switched to being a virtual event. So all of our meetings were held over Zoom, but we had 217 participants, and more than half of them were patients and caregivers. And I think this really speaks volumes to the way that advocacy has evolved in our communities over the last several years. It's fantastic to see so many more people who are impacted by the disease speaking out and not leaving it up to the providers to solve this problem. And I'm continually so impressed by the cluster headache community and how engaged so many of you are and your willingness to take part and advocate in events like this. I just want to share a few of the initiatives that that AHDA and Headache on the Hill have been focused on to give you some ideas of the types of things we work on. So I talked about NIH, and one of our big successes that we had back in 2016 is we actually had a bill signed into law, and this was a very important bill because there's specific language in there that talks about the need to pay attention to disease burden, how burdensome a disease is when allocating the funds that NIH gets for the various research activities. We helped to implement this $500 million a year in funding for an initiative called the HEAL Initiative. And the key point about this really is that because of that language in the Stop Pain Act, there is supposed to be a certain amount of those funds going into migraine and headache disorders research. We advocate to the Department of Defense. Who would necessarily think Department of Defense has an interest in headache research? They do. They have something called the CDMRP, Congressionally Directed Medical Research Program. And over the last several years, they have funded about $20 million in research on chronic migraine and post-traumatic headache research. They've made these eligible areas to fund grants. And that's equivalent to a year of funding from the NIH. So that's significant. We've been advocating to the Department of Veterans Affairs to get funding to establish VA headache centers of excellence. These centers came about because of the funding that AHDA got. And initially we got $10 million. This year for our Headache on the Hill ask, we were actually working to double this, more than double it to $25 million a year. And we're midway through the progress of hopefully seeing that come to fruition. The thing that's probably going to resonate the most with those of you on the phone or on the call today is our work with CMS. This has been going on for far too long, but I'll dig into this one a little more. The advocacy to get Medicare or CMS to cover home use oxygen for people with cluster headache. And then we've also been working with the Social Security Administration to advocate for more equitable policies around the disability process. So let's talk a little bit more about the oxygen situation, because my guess is this is what you're most interested in. So there has been so much going on, and it's so hard to say to you, the person who's waiting and not having this covered. It probably seems like, what are these people doing? Why aren't they getting this covered for us? What's taking so long? And it is, I don't even know what the right word is, completely egregious that this takes so long, but unfortunately working with federal agencies, they're not easy to move. So back in 2011, actually, was when CMS, the Center for Medicare and Medicaid Services, published a new policy called an NCD, which is a National Coverage Determination, where they specifically said they were not going to cover home use oxygen. And essentially, we've been at it ever since. 2014 was when things started to get more formal, and our organization sent a letter to CMS. There was also a letter sent from specific members of Congress. We had 15 members of Congress sign on to a letter reaching out to the administrator of CMS. Nothing, this got slow walked, things weren't happening. Finally, in 2017, the American Headache Society and AHDA and Clusterbusters had a phone meeting with the coverage and analysis group from CMS, hoping to move this forward. In 2017, we also identified a champion in Congress. Representative Andy Harris, during one of our meetings at Headache on the Hill, it came up that he was a person who had cluster headache, and he knew the importance of oxygen, and he said he would stand with us and he would help us get this through CMS. And he has continued to advocate with us and been a source of support. In 2019, we filed what's considered a formal appeal. So we went through all of the, dotting the I's, crossing the T's, doing everything CMS requests to file an appeal to get an answer about, would you change this policy? And that's supposed to take them 60 days to respond to, but it took them 18 months. I'm highlighting the key points here. There's lots of contact happening to the agency in between each of these bullets or these boxes. But essentially, finally in 2020, they came out and said they were going to review our request, and they needed to hear from the public about why this was important. And that's when we got many of you engaged. We had over 328 comments submitted to CMS. And then we waited again. And finally, in July of this year, they came back and said, okay, we see that there needs to be some changes. It was essentially positive news that they were sharing with us when they issued what's called a proposed decision memo. So this is what they're drafting. This is what they're suggesting is going to be the policy. But before they can put it into place, they need to give the public a chance to comment. So we reached back out to several of you. And again, we got over 100 comments submitted, letting CMS know what we liked about this proposed decision memo and what some of the challenges were, or areas where we thought could be problematic and should be changed before this came to be the final policy. And so now here we wait. Technically, if CMS followed the rules, to a T, they would owe us an answer on September 30th, so next week. I don't expect we're going to hear from them that quickly because historically they've never gotten back to us in the timeline that's been published. But I did reach out to them just in the past 2 weeks, and they're certainly working on it, and they won't give me a date, but they said they're hopeful that it will be this fall. So stay tuned. We may need more support from you. Hopefully we'll be able to put this issue to bed soon. But this is a great example of advocacy and what we do at AHDA and why we need so many of you involved. It's a long process, but it's hopefully going to drive significant change. And finally, I just want to share a couple of lessons that I've learned about advocacy over the years. Success is incremental, just like this example I just took you through with oxygen. The timeline is long. You make little gains along the way. And that's kind of how it works. It's not like you go make an ask of Congress or an agency and they get back to you the next day and say, sure, yeah, no, we'll change that policy for you. Often when you get news and you hear back, it's somebody saying no, and you have to stay positive and understand that if it's bad news, that's okay. They're trying to kind of knock you off your track, and as advocates, it's our job to stay focused and continue to come back with new ideas and different ways to approach the problem. You'll always hear, especially I would say over these last couple of years, like, oh, this is the worst time to be advocating. There's so much going on, in Congress right now. Our government's a mess. Like, they can't handle taking on these issues. And there's always going to be some crisis happening in our government, but that doesn't mean we stop advocating. You actually just keep doing what we need to do, and someone's going to listen to you. And then listen carefully and openly to those who disagree with you. So it can be challenging to be in these meetings with people who, you feel like they're just kind of giving you the and you just want to shake them. But you have to listen to them, look for avenues to connect with them and make progress. So if you think you might be interested in getting more involved. Headache on the Hill 2022 is happening on February 15th. We're going to open up the application process in November. If you sign up for our newsletter at our website, allianceforheadacheadvocacy.org, you'll be sure to get an email as soon as we open up the applications. And if you have any questions for me after today's presentation, just feel free to send me an email. And that is it for me. I'm going to turn it over to Ashley next, I think, or do we want to take questions?
I haven't seen any, so I think that we're just gonna bring Ashley up and let her talk, and then we'll put everybody together.
Okay.
I did want to. Oh, I should turn on my camera apparently. I did want to make a couple notes. First of all, Katie, thank you so much for the presentation. I love hearing about Headache on the Hill, but mostly because I love participating in Headache on the Hill. It sounds like this scary thing, and it is kind of scary. The first time you walk into a senator or representative's office, either virtually or in person, you're a little like, this is intimidating, but ultimately it's rewarding and inspiring, and it makes you feel like you are participating in the process, and it really makes you feel good, and like I have control and I have power, even if it's just a little bit. Like Katie said, some of these things can take a really long time to work through. And I was stunned this week because if you were on earlier today, you heard Ainsley talk about the progress with legalization of psilocybin in the UK. And she has been working through that process for what she felt like was a very long time. She's been working on it for 20 months. So like in our world of the United States, 20 months is like, well, that's nothing at all. But in other places around the world, 20 months is a very long time. So if you're joining us from another country, find out what's going on to advocate for yourselves politically in your part of the world. And it might not take you 10 years. It might not take you 20 months. It could be somewhere in between, but it really is worth it when you see results like what we're getting with Oxygen. Hopefully we'll hear back this fall, or what Ainsley has seen in the UK with her advocacy work. So thanks, Katie. All right, and now we are going to bring up Ashley Hattle. As Caitlin is bringing her up to the stage, I will give you a little bit of information about Ashley. You met her earlier today if you joined the group that discussed couples with cluster headache. Ashley is a writer. She has written fiction, and she is a medical writer. She is the author of Cluster Headaches, A Guide to Surviving One of the Most Painful Conditions Known to Man. And if you don't have that book, get that book. We will tell you where to get it, because it is really a great guidebook for living with cluster headache and all you need to know about it. I think she's working on a second edition if it's not already complete. I don't know. We'll let her tell you. She's also been an advocate for people living with cluster headache. She developed and hosts the Cure for Cluster 5K, which we talked about earlier today, and is a wonderful event. She has raised tens of thousands of dollars for research through doing that event, and she is here to tell you all about why she does what she does. Welcome, Ashley.
Hi, can you hear me okay?
Yes, we can hear you great.
Thank you for the awesome introduction, and thank you, Katie, for your presentation. I've attended Headache on the Hill for maybe 6 years, and it's a great experience, and I really think that if you are able to participate, that you should. It's really rewarding to go to the same offices year after year and have them remember you and actually care. Like Eileen mentioned, I'm going to talk to you about the advocacy for cluster headaches that I've done over the years. The Cure for Cluster Virtual 5K is kind of my baby in a way. I started a support group in Denver back in 2016, maybe the end of 2015. And at first it was just 3 of us hanging out at a bar, just swapping stories. And then it grew to be I think there were 15 of us there before I left for Michigan. And we were trying to come up with a way to raise funding for cluster headaches, specifically for research, because like Katie highlighted, there's not a lot of money being put towards headache research, especially cluster headaches. So we wanted to raise money, and the idea that we came up with was for a 5K, because in Colorado, people tend to be very active and it's sunny 300 plus days out of the year. So our first event, I'm getting a little ahead of myself. Let's do the next slide. So right now, the Cure for Cluster 5K is a virtual event, and it has been since the second year. So basically you sign up, and like a week before the race or a few days before the race, you receive a package in the mail with your t-shirt and a swag bag of some fun stuff. We had a cooling, the gentleman in the first slide had it around his head. It's like a cooling pack. And then you wear the t-shirt, run or walk 3.1 miles, and take a picture and share it to social media. And the goal, in addition to raising funding for research, is to start a conversation. We were stopped a few times in our neighborhood over the years to talk about it, or, we would wear our shirt at a coffee shop and someone would mention that they have migraine disease and it would spark a conversation. So, just having the t-shirt helps to start that conversation. So that was the goal of the event, and to share your story. Could you go to the next slide? So this is where we started. One of the points I want to drive home in this presentation is consistency. So only half the people in this photo were signups. The rest of them were kind of forced to come because they knew me, or they were, part of the sponsors or were related to me. But it was so much fun, and we had some people come down from Wyoming to Colorado to do the event, and it was really great. But we figured out that the next year we needed to do something different, because there were people around the world who wanted to join the event who couldn't travel to Colorado just to run or walk 3.1 miles. So the next year we did a hybrid event, and then in 2019 we went fully virtual. Let's do the next slide. I don't know why it's highlighted. It was not highlighted when I made the slide. So we've had 5 years of 5Ks. We're coming up on our 6th one on June 25th, 2022. And we've had people around the world participate, 8 different countries. Like we've had people in Finland and Poland and the UK and Scotland and Canada, all over the place. And I think we've had 42 states participate. And over the years, we have raised $18,000 or $18,042.56. It might be a little bit more because I couldn't find the numbers for our first year, but our first year we didn't raise that much. Next slide, please. So this is one of the Cluster Busters conferences where we gave a big check to Dr. Shore for research. So part of what we've helped fund with this advocacy event is the statistical side of the International Cluster Headache Survey. And it's helped people, I'm not sure what's happening with the slide. It's helped people understand the severe impact that cluster headaches have, not only physically, but mentally, and affect your ability to work and really function. Next slide. So the beautiful thing about a virtual event like this is that you don't have to start when we start. We try to get started by 9 a.m. Eastern time, but if you are where Ainsley is, that's much later. So it really just depends where it fits in your schedule. And I'm sure there are some people that, do it on a treadmill or maybe only do a mile or so. It's mostly about just sparking a conversation. And it's really cool when people wheel along their oxygen tank, because then that's even more of a conversation starter. Next slide. So you can see over the years, I think this was 2020. Yeah, and that year was really big because of the pandemic. Everybody was doing virtual events. Next slide. And so you can see in one of the photos what comes with the swag bag along with your t-shirt. It's handouts that help explain cluster headaches to your loved ones, and a magazine with 10 other stories of people living with headache diseases. Next slide. There we go. So one of the things I love the most about a virtual 5K event is that you get to interact with people around the world. You can see Ainsley swinging on the swing as she did hers last year, or maybe that was this year. And then in the upper right-hand corner, you can see Tony in Finland. He is a huge advocate. I'm going to butcher it, but I think it's the Finnish Association for Horton's disease, Horton's neuralgia. But it's been really great to get to know advocates in other countries. Next slide. So I put this together maybe 2 years ago. Cluster headaches have not always been called cluster headaches, and they aren't called cluster headaches around the world. We asked the people in one of the bigger Facebook groups for cluster headache patients what they're called, and these are all of the terms for this condition around the world, which I thought was just really cool to be able to see its many names and not get hung up on the word headache. Next slide. So I need to put a link in the chat. I meant to have it under copy and paste. But we are having the 5K again next year on Saturday, June 25th. And if you sign up now, you save $5. I think the price goes up on January 1st, 2022. I'm not sure if Eileen could put that in somewhere. It's runsignup.com. If you just search Cure for Cluster, it'll come up. Next slide. So this is just one way to get involved with cluster headache advocacy. We are a small patient pool, so really anything that you have the energy to contribute will benefit others. But advocacy isn't just about doing, Headache on the Hill and doing 5Ks. And I know Katie touched on that too. Like, you are already an advocate just by attending this virtual event and learning more about your condition. You are an advocate every time you take a few minutes to talk to your pharmacist about cluster headaches, or your cousin, or anyone who's interested in learning more. If you were watching the talk earlier with my husband and I ran into an issue during pregnancy where I had a cluster headache cycle in the second trimester. And I tried to get my oxygen refilled, and they told me that my prescription was expired, even though it had been expired for 2 years and they'd been refilling it. And they refused to give me another tank, and I had 45 minutes left on my tank. And I definitely had my moments of woe is me and crying, but ultimately I decided that this wasn't fair, and I didn't want the next pregnant woman or the next cluster headache patient period to have to go through that. So I put together a little package, and I sent a copy of my book, a copy of Dr. Shore's published study, along with a nice but stern letter, and I sent that to the CEO along with their main office and the Benton Harbor office that I was dealing with. The next day I got a phone call from the CEO, and they not only made sure that I had oxygen that day, but he said that he was going to change the way that they train the people who handle those phone calls, and make sure that they know that there is a grace period. Like, if your prescription is expired, they notify you and give you like a one refill in the meantime. So I'm really glad that I did that. It was a lot of tears and a lot of struggle, but it did make a little bit of change for this small oxygen company in Michigan. So advocacy is not just these big events, it's things that come up in your daily life that are aggravating and need to change, and someone's got to do it. And sometimes just a few minutes can help get that started. So if you do want to do something bigger, Cluster Busters helps people start support groups in their area. So I know that Eileen is interested in helping create more of those. And you can brainstorm ideas for your community. Like in Colorado, we knew that it was an active community, so a 5K was going to go over pretty well. And you want to stay consistent. Katie mentioned, you know, from 2007, I think it was, maybe 2004 to 2021, like it's a huge difference as long as you keep coming back. And people remember that and are going to be more likely to participate again and donate again. And we see that with the support groups too. The Denver group started with 3 people and has more than a dozen now. So most of all, don't give up on you and your ability to make a difference. And I think that's the last slide. Are there any questions?
First, I just want to say, Ashley, thank you so much for sharing with us your advocacy efforts and illustrating that you know, advocacy isn't just doing the legislative advocacy, but there are lots of different ways that you can advocate. And it can be something really small or it can be something big. I also wanted to mention that, yes, I did put that link into the chat. And also, if you go back to the socio lobby, if you come back into this event on the agenda, links to the Alliance for Headache Disorders Advocacy and the 5K will always be there. So you can find those links again later if you need to. So what kind of questions do we have? Does anybody want to unmute and say anything, or would you like to share? I can share in the chat. While you were talking, people were like, we need some kind of a viral challenge, like, you know, the ice bucket challenge, and people were talking about maybe not stacking milk crates or Tide Pods, which I think is a really
I like the milk crate idea. Only the strong and agile will survive. We can make it a whole big thing.
Yeah, well, I will not sanction that because I'm not sure my liability coverage reaches that far, but if you all want to do it, that's your prerogative.
In Canada, they did a brain freeze challenge because, I mean, the closest they could come up with to compare a cluster headache would be to a brain freeze. So they would challenge people to chug a slushie.
Oh, wow.
Yeah.
That's not a bad idea. I mean, how far did that go? Did they get actually people to do it on camera?
I think the Trailer Park Boys were involved. It was Tom Termeer, who's a big cluster headache advocate up in London, Ontario. And I'm pretty sure he got them involved with that. But I don't think it was not viral by any means. Maybe
I mean, but why didn't it go viral? Did they like wuss out, then like figure out that it hurt too much and like, oh, like, I mean, the cinnamon challenge was a little painful too, and that one went around. I mean,
what was the cinnamon challenge?
Oh, cinnamon challenge when they took a spoonful of cinnamon and like took a big bite of it, and it would just sort of poof out of their mouths, like, and out of their nose and burn all the way in.
So dry.
They look like dragons, like there was like a poof coming out, like in like a cloud of cinnamon.
People are willing to do things that they don't know exactly what's going to happen or how it's going to turn out. The problem with the brain freeze challenge was most people have experienced that and they would never purposely put themselves through that.
Oh.
So that'll tell you something about cluster headaches. It's like, yeah, well, we wouldn't ever want to put ourselves through one either because it lasts a lot longer than a brain freeze. But so that one never really caught on. So yeah, so the ones with eating Tide Pods and cinnamon,
Well, right. I
people
mean,
will do
people
that for
are
the first time.
purposefully doing that, knowing that, well, maybe they don't know that it will hurt them, but they do that anyway. So
Yeah. Well, yeah, they'll eat, hot peppers and, all kinds of things. But yeah, we've
right, but eating ice cream is objectionable somehow.
yeah. Yeah.
Just
They'll
not
film
really-
themselves eating the hottest chips, like
Right.
with that one single hot chip.
If we ever wanted to do a fundraiser that was a pepper eating contest, I would do that 100%.
Oof, I'm
Yeah.
not sure. My husband might.
Well, that is actually, sort of a treatment for cluster headaches where people have snorted red pepper and Tabasco and, all kinds of things. And yeah, there is that one treatment with the nasal spray that's Civamide or something, which is basically hot pepper, capsaicin. Yeah. So yeah, that would be one road to travel down.
And we have to
Ultimately,
come up with some sort of viral challenge where a bunch of teenagers will just feel comfortable making a fool of themselves in front of the camera so that it becomes viral.
Yeah. Well,
Yeah.
Does anyone even remember what the ice bucket challenge was for?
Yeah.
ALS.
ALS.
ALS. I bet that like most people who actually did that challenge couldn't even explain to you what ALS was.
It's
Right, but they were
actually
just-
a pretty interesting case study because it really did put ALS on the map. Like people who had never thought about it before now know what it is, and their donations for advocacy and for support have like increased tremendously. Kind of like when oh, what's his name? It's not Alex Keaton, the actor. Michael J. Fox got involved with the Parkinson's community. So like, yeah, we want things to go viral and stuff, but ultimately we need to stumble upon it or, maybe have the kind of PR that will get influencers involved, which costs money.
Mm.
Yeah, like as much as I would love to get something to go viral, we don't know how. If we did, we'd do it. Well, we know how. We don't know how to, stumble upon that.
You take the milk cartons and you put them on top of each other.
Right?
yeah.
Well, TikTok is its like own weird land. Nobody knows the algorithm yet.
It
Yeah.
is. Like I have videos on TikTok, like I don't know why some of them are like at none and then other ones are like 100, 200,000 views. I'm like, what? Why?
Right. It's very strange.
Yep.
So what other questions do we have? Does anybody else have anything burning they want to talk about? Anybody else want to share their own advocacy initiatives? Share about your experience at Headache on the Hill or reading Ashley's book or forcing Ashley's book upon their doctors, which I do every time I get a chance.
Good.
I
My
even
neurologist
forced
is
it
retired.
on an emergency room doctor that I know.
Awesome.
Yeah.
I did see that Tony's in the chat. Thank you for staying up to watch. I don't know what time it is in Finland, but I know that it's late.
Yeah, it's got to be like 2 o'clock in the morning there.
Hey, where is Tony? I haven't seen Tony. I've never actually met Tony.
2 a.m.
It's 2 a.m.
on the chat.
Yeah, he's not on screen. Nobody wants to be on screen. We understand you're shy, but
And it's
Yeah.
the Finnish Horton Association. That's the name of his organization.
Right.
They're doing really great stuff over there. It's awesome to hear about.
yeah, ultimately there's groups forming all over the world or already formed. Vera asked, did the ER doctor read the book? Yeah, he's my neighbor and I see him nearly every morning at the bus stop. So if he hadn't read the book and given me a book report at the bus stop, it would have been, I would have bothered him about it some more. So yeah, he did read the book. And he said that my bothering him about the whole headache advocacy community and the migraine community made him think differently about emergency room medicine and like what's going on, because from his perspective, you know, he has the same perspective that every other emergency room doctor pretty much has, that somebody who comes in pain is not necessarily an emergency. And so he doesn't really look at it that way, but he started thinking about how terrified we all are to go to the emergency room because we know that we're not going to get the care that we need, and how he can contribute in fixing that. And he's only one emergency room doctor. And since we've started these conversations, COVID happened. And so he's been kind of focused in a different direction. But I think that once the pandemic is over, he'll probably swing back around to how can we work together.
That's what a lot of advocacy is about. It's just kind of happenstance, you know, having a conversation with somebody and you figure out who's interested in hearing more and who's really not. But it's kind of those random conversations that end up changing somebody's perception of what the disease is, or getting them more curious about it. And, you know, that's how we break down the stigma, and that's how we get more people to understand better. And then we get better support and better resources. It just kind of snowballs, but it's just these little conversations can have a huge impact.
Yeah, and what's really funny to me about him is that he lives with vestibular migraine, which can be really debilitating for him sometimes while he's at work, especially. But he didn't think about his own personal challenges and relate that to work, other than I'm trying to keep my personal challenges out of work. He didn't think about it from the other side of like, what if he went into the emergency room with a vestibular attack or a cluster attack or any kind of headache attack. Ashley, when is the second edition of your book coming out, or is it out already?
That's an excellent question that I wish I had a sooner answer for. My goal, so I did a bunch of new interviews that I still have to sift through, mostly neurologists, but about like a dozen more patients and loved ones. So my goal for the rest of the year is to get through all of those recordings and identify like what I would like to add. And after that, it shouldn't take too long to update the book and get it printed. So the latest would be spring.
That's not bad. Spring's good.
Well, I'd been hoping, I hope to have it out before I had my baby, and that was 10 months ago. So
I think you're still on time.
Good. That's what
Well-
parenthood does to people. It slows a lot of things down.
definitely does.
Yep.
But you enjoy things more.
Yeah,
Let's say that
and your husband can come up with a lot of dad jokes, so that's a good thing. Yeah.
Yeah, he already told them, so now he just
Yeah. Yeah.
So I don't know, is Brian McGeaney in here?
He was. I don't know if he's still here or not.
Oh, no, he's in the open chat right now. So he had this idea about advocating directly, like Ashley did, to the oxygen providers that we all have, to let them know more about what cluster headache is all about. Because 9 times out of 10, your oxygen provider has one cluster headache patient and like a bazillion people with COPD or whatever. And so he was encouraging me to reach out to all of the oxygen suppliers in the United States and send them, you know, Ashley's book or information about cluster headache. And I was like, that is a lovely idea. I don't have the time to do that. But if we could mobilize everybody in the community to just reach out to one oxygen provider, we might be able to tackle that goal. So like Ashley said, this is something that you can think of doing. And it won't take much effort on your part. It's just, you know, you don't necessarily have to like chase down the CEO, but you could, you know, talk to the lady at the front desk and be like, here's some information. Maybe you could pass it along to the higher ups and then follow up with them and see if they've read it and what they think.
I got lucky with
We-
Airway Oxygen being a small company. They are only based in Michigan, and I think they maybe have 8 branches. Now, if it was a large company like Apria Oxygen, I would not have had the success that I did.
Could we
Apria is a
help
nightmare.
put together an information packet on our website that people could give to their own oxygen company?
I love that idea.
It is a really good idea, and all the information is there, but for that specific goal, it would be helpful to have it all put together in one little package.
I can share with you guys what I sent to them.
Awesome, thank you.
It was 2 studies and then a personal letter and a copy of my book. I think it was the studies that really got through to them. I figured out of the 4 things, they were at least going to look at one.
Yeah.
They like data. So I've just been waved at and told that I'm over time, and I didn't even realize it. I wasn't watching the clock. I was enjoying talking to you all. So we're going to have to wrap it up. I just want to say a very special thank you again to Ashley and Katie for joining us this evening, sharing their experience, all they've done.